Okay, so when we're talking about the internal fetal monitor, which is in this video, I talk about how it's attached to the scalp with the electrode. This leads to a much deeper question of like, why do they do it? They do not use it to pull out the baby. Absolutely not. It's not. It wouldn't even be stable enough to do that. But that being said, there's a much deeper conversation here about what research says about fetal monitoring in general and how it actually has only increased interventions and not improved outcomes. But that's a whole nother discussion. But what we can talk about is the fact that, you know, this is one of the things that needs to be considered if you're considering an induction, because it is far more common during an induction of labor, because induction of labor frequently stresses out the baby. And so why would they use an internal instead of those external monitors? So first of all, sometimes if you're a little more overweight, it's harder to trace the baby on the outside. If you have an anterior placenta, this can happen. And sometimes if the baby is posterior, it's harder to get the monitoring on the baby. But if you're having a normal physiological birth, meaning you went into labor on your own, research says that non-consistent or just occasional monitoring is acceptable. So then that means you don't even have to be on there. If they can get it even for just a few minutes, then it's sufficient to check that the baby is fine. Now, if you're doing an induction though, they want to monitor you all the time. They do not do intermittent monitoring typically for an induction of labor. And the other thing that's important to understand is that an induction or one intervention is never just one intervention. And typically, if they're wanting to do an internal monitor, it also means that they have to break your water first in order to be able to get in there. This means now that you are opening yourself up to a risk of infection and additional interventions. And in most cases, all of those sort of interventions will be fine and not develop into anything. But in a good chunk of people, it does happen. And so these are the reasons why I started BirthFi, because there's so much that people don't know that they should know about to be able to be informed and make informed decisions. Because I'll tell you what, the number one thing in my 22 years that I've heard from second-time moms over and over again was, if I would have known this, I wouldn't have done that. We're not here to tell you what to do. We're just here to give you the information so that when you're laying there in the labor, you can actually have some knowledge there to make a decision. And this monitor is a perfect example. Just go read through the comments. How many people said they didn't know that that's what it was, or that they were told it was a sticker or a clip? In some cases, it's a good idea to have it from a medical indication standpoint. So I'm not trying to fearmonger, as a couple of people have said. This is about information. It's like, I don't know. I know some people don't care to have the information, but I prefer it for myself. So anyways, if you want a detailed guide to literally talk through all of these things for you before you go into labor, check out BirthFi.